Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas, beautiful Amarillo, Texas, and I'm here with another video this week. This week we're going to talk about backpack safety that parents must be aware of. Know this, just because they're kids does not mean they're invincible. Now this is a challenging time for kids and parents and teachers to be returning to school. And while we desperately want and hope for a return to normal for our kiddos, the truth is that it will be anything but normal this year. Due to the ongoing COVID pandemic, schools will likely look very different this year. What will be the same, though, and worse in some schools, is the use of backpacks. And I say worse because in some schools, lockers will not be assigned this year. That means that even more stuff gets piled in and pushed into a backpack to be carried around all day long. And that's why it is imperative for parents to understand the best ways to go about instructing their kids on the use of their backpacks. Before the pandemic, 96% of kids aged 8 to 12 years old carried backpacks throughout the day at school. And it is estimated that up to 1/3 of those kiddos carry them incorrectly. As previously mentioned, that 96% number is likely even higher this year due to the unavailable, unassigned lockers. And this means that over 1/3 of kids are likely carrying these backpacks improperly all day, every day, at a time when their little bodies are still growing. They're still adapting to outside stresses and forces, and they're still maturing, all at the same time. And did you know that children suffer from back pain too? Of course, not on the scale that us old creaky adults suffer from back pain, but children are not invincible. They experience the strains and stresses of normal life just like we do. It is natural to have a feeling that kids are good to go, but that just isn't completely true. Not only are kids susceptible to pains as they're maturing, but they're also known for developing bad habits early on and maintaining those habits as they grow into mature adults. And this holds true for a score of bad habits, but most notably in recent years is their text neck position that the kids have made so famous, where they're looking down at their phone all of the time. And not to mention the array of other postures that they adopt while they are interacting with their electronic devices. They're going to pay for this stuff one of these days, I'm telling you. But getting more to the point here, your kids are in the process of growing and still developing. And so that means, as mentioned, they're adapting to outside forces as well. And they suffer from aches and pains as a result, and parents should not make light of this. Kids need to visit chiropractors periodically as well if they're having some issues that need to be addressed. Part of it all is making sure that these kids are carrying and using their backpacks correctly, as they can literally be the biggest instigator of pain in children. Now, here are some general rules and guidelines. We have created this information in a blog on our website at amarillochiropractor.com. Go to the blog, go to this area and print it out, cut it out, and paste it on your refrigerator as a reminder each day when they head off to school. A bigger backpack is not a better backpack. When you buy a bigger house, you just get more stuff to put in it, right? Ladies, if you get a bigger purse, you usually get more stuff to put into that purse. So now you also have a bigger purse and a heavier purse. You know what I'm talking about. A backpack should be large enough to carry the essentials, but no bigger than that. Now next, no heavier. The backpack can be no heavier than 15% of the child's body weight. Weight is the most concerning aspect of carrying a backpack around all day. It is the key factor that delivers stress to a child on a day-to-day basis. For a kid that weighs 150 pounds, well, the backpack should be no heavier than 22.5 pounds. For a child weighing 100 pounds, it cannot be any heavier than 15 pounds. Right? 15 pounds is not all that much. Go check it out. If you are mathematically challenged, simply enter your child's weight into a calculator and then multiply that weight by 0.15 to get the weight that the the backpack should not exceed. Super simple. And it is our duty as parents to monitor through the year, as we know kids, they like to add stuff to those backpacks without even mentioning it to us, right? You know what I'm talking about. Now, next, heavy backpacks cause a forward lean. When the backpack is overloaded, it has a tendency to pull down on the child's shoulders. And in response, children commonly adopt a posture of bending forward to carry more of that weight on their backs in an effort to compensate and reduce the strain on their shoulders. So this is obviously not a good scenario in biomechanical terms. It puts a good amount of strain on the low back discs when you bend forward, not to mention when you add load to it, and not to mention other issues like muscle imbalances and muscle strain. Now, next, get the double wide. What does that mean? The width of the shoulder straps is definitely worth talking about. Thin shoulder straps really have a tendency to dig into a child's shoulders and can literally, ultimately cause nerve or circulatory damage. Wide straps are much less likely to cause these types of issues. That, and recall when I said no heavier than 15% of the child's body weight, okay? Next, tighten the straps. Tightening the straps, the shoulder straps, makes the bag hang closer to the child's body, which keeps it from swinging around and putting odd and unbalanced stresses on the body as they walk. Next, no low hangers. No low hangers. Do not allow your child to think that they're cooler than they really are. Do not allow the bottom of the bag to hang lower than 4 inches below the child's belt line. Low hanging bags can cause the child to develop the forward leaning posture that we were talking about, which leads to, again, increased stress and strain on the low back, and there's just no logical reason for it in the first place. And lastly, use both straps. Using both straps when carrying the backpack is key. When they only use one strap over one shoulder, the weight is carried only on one side of the body rather than distributing the load evenly across the body. Well, this causes the kid to lean the other way in an effort to compensate. And biomechanically, that's just a bad idea. Certainly when this scenario repeats itself day in and day out for months on end. And adjustable straps while we're at it, okay? Adjustable straps should be used. They allow the parent to more effectively fit the bag to the child, keeping the bottom of the bag at or above the belt line and held closer and tighter to the body for a good fit. So let's assume that your child is not fussing about their backpack, okay? In fact, it's just the opposite. They're packing more and more stuff into it, and they're not telling you. How can you, as a parent, identify problems on your own without your child mentioning anything about it? Well, the struggle is real, okay? Just remember that. The struggle is real. When you see the kiddo struggling a bit to pick the backpack up and get it onto their shoulder or shoulders, well, then you know the bag is clearly too heavy and needs some stuff taken out of it. When your child develops what we've mentioned a couple of times here, the forward lean, they do this in an attempt to take the pressure off of the shoulders and carry more weight on the back itself. Children commonly adopt this forward leaning posture when the bag is too heavy. So take stuff out. And okay, maybe they are griping. Every now and then they'll gripe. If your child does start complaining of neck and or back pain unrelated to any activity like sports or some traumatic event, well, then it's likely due to backpacks, and attention should be given to its proper use. Backpack safety is really easy once it's explained and once you really kind of just start to think about it a little bit. Unfortunately, not all parents know the basics, right? For that reason, I want to ask you all to share this information with your friends, with your parent friends that have kids carrying backpacks around all day. That way, we can be sure that kids are doing backpacks the right way this year. Again, I'm Dr. Jeff Williams. I hope you find our weekly videos useful and informational, and I hope you're sharing them with your network and getting a lot of good out of it. If we can help you, again, I own Creekstone Integrated Care. We have an amazing facility here with chiropractic, exercise rehab, decompression for discs. We've got acupuncture, and we've got 5 massage therapists, and this is a place for healing and doing it in an evidence-based way with good, short, responsible treatment schedules, and it's a good place to get better, right? So if we can help, thanks, and we'll see you again next week. 3000, or visit our website. It's amarellachiropractor.com.